Hi, my name is Angela. I'm 36 years old. On November 18th, 2011, I had a microdiscectomy at L4-L5 from a car accident that I suffered in 1998 and had been having significant problems, sciatica, since. So I had the surgery, immediate relief from the surgery. Same day. Recovery was virtually nothing. 2 weeks after the surgery, I was back to doing, Zumba exercise classes 3 times a week, working, everything was fine. Starting December 26th, after my normal Zumba class, started feeling a little bit of pain in my left butt cheek, kind of like the muscle had been pulled. So I thought maybe I was just sore or whatever. It significantly progressed over the next couple of days to the point where I was virtually unable to walk. I couldn't get in to see my orthopedic doctor because of the holidays, so I went to see my PCP. She ordered an MRI, and on January 2nd, I went and had the MRI done. On the 3rd of January, I called the orthopedics office again and said that I'd had the MRI, that I had been to the ER, because I wound up having to go on Friday, the day after I saw my PCP, because the pain was just too horrible. They basically did nothing, blew me off, gave me a steroid injection and oral steroids. So when I called the ortho, they managed to get me in the next day, and so I went in. They looked at the MRI and saw that I had a cyst, probably about 8 millimeters in size, right around the area where they did the discectomy. I'm going to try to show you a picture of the MRI. If I can get it up here. I don't know if you're going to be able to see it. But basically, there's where they did the discectomy, and there's the cyst. So they took the disc and shaved everything back here, and then I got this cyst here. So the plan was to try a steroid injection at the site to see if I could get some relief from that. That was on, I believe, Wednesday, January 1st. They got the authorization from my insurance the next day. They could not get me in until Friday, January 13th for the injection. I have been bedridden the whole time. The doctors have been giving me every painkiller known to man. I have Dilaudid, I have OxyContin, I have 15 milligrams of oxycodone, I have Valium, I have Soma. Pretty much everything that you can think of, I have. None of it has helped. The Valium has helped with the muscle spasms. So I finally went in and had the injection. It was really, really painful. I'd had injections before. This one was really painful because of just the amount of pain that I was in. The doctor felt confident that she had punctured the cyst because of the resistance that she had gotten. So I felt hopeful. That was on a Friday, so I went home. I rested. Saturday, I started feeling a little bit better, a little bit of relief, not too much, but I managed to go out to the movies with my husband and my two kids. We have two girls, they're 6 and 8, and obviously with me being in bed, I haven't been spending a lot of time with them. So then Sunday, woke up a lot of pain. Monday, a lot of pain. Basically, I was almost exactly back to where I was prior to the injection. So I contacted the ortho, and they said, you need to give it more time, you need to give it more time, you need to give it more time. Well, I was supposed to have an appointment on the 18th, and I went down there, and apparently it had been canceled. So I managed to talk to the assistant, and she said that the doctor needed to consult with a colleague about my situation, and that they would call me on Thursday, which was yesterday. They called me yesterday and said, we need to see you on Friday at 1 o'clock. That's today, January 20th. So I went in Friday at 1 o'clock. He basically said that my situation isn't uncommon, but it isn't, it's more on the rare side. It happens, but it doesn't happen that often. His colleague actually has a situation similar to mine, which is why he needed to discuss with him the options. So he gave me two options. One, go in and resect the cyst and close it up. Or two, go in, resect the cyst, and fuse the disc, with the assumption that fusing the discs together will keep the cyst from coming back. I decided at that moment that I do not want this to come back. I do not want to have another back surgery yet again. I do not want to be bedridden anymore. So I don't care if it's a bigger surgery. I don't care if it's longer recovery. I'm going to do the spinal fusion. There's actually a great video on YouTube, Johns Hopkins video about treating synovial cysts, and after watching that video, it's about 8 minutes long, kind of boring, a lot of medical jargon, but the last 3 or 4 minutes is worth it. I kind of decided that after watching that video that my decision is the best. So this is the first video. I am scheduled for surgery on Tuesday the 24th, which is today's Friday the 20th, so 4 days. I'm going to have spinal fusion surgery. I'm hoping that I will be able to update the video log and let people know what has happened. I'm hopeful that this will be my last surgery, because I cannot stand this pain, and I cannot stand being in bed. It's boring, it's lonely, I hate it. And I'm hoping that if there's somebody else here that has this issue, that this can help them figure out what they need to do. And you need to be adamant, and you need to push and push and push and push and push to get something done, because all they wanted to do was throw pain meds at me, and pain meds do not work. So anyway, that's it for now. Hopefully I will talk to you after surgery. It'll probably be a couple of days after surgery. I'm understanding that I need to be in the hospital for a couple days. So I doubt I'm going to be in the mindset to record a video. But thank you, and hopefully this will turn out the way I am hoping. And hopefully it will help somebody else. Thank you.